Our next speaker is Frank Buttgereit from Germany. He's Deputy Director of Rheumatology and Immunology and Professor of Rheumatology at Charité Medical School, Humboldt University. Received his medical degree at Charité, as a resident there, and he's been an honorary professor at rheumatology at Rosario University in Bogota, Colombia. He's received the Humboldt Award for research. And this morning he's going to talk about an area that he's interested in, and it's amazing, all the years we've done CCR, we have never talked about glucocorticoids, one of the most common things we use. So he's going to give us an update on glucocorticoids.
Dear David, ladies and gentlemen, thank you very much for the kind invitation to give a talk today on these really old drugs, not that sexy as compared to the ones we've heard about yesterday, for example, but as you said, David, they are just important. We use them all on a day-to-day practice, and that's why I do think it does make sense to discuss their clinical use, the mechanisms of action, and adverse effects and new developments. Now, to start with, I should first like to make you familiar with my financial and competing interest disclosure. As you can see from this slide here, I'm working together with several different companies in order to develop improved, better glucocorticoids. I will be coming back to that later in my talk. I'm also a member of certain groups, for example, a member of the EULA task force dealing with glucocorticoid issues. We always try to answer the question, how can we improve the usage of this drug or these drugs in rheumatology? And I'm also a member of some other groups, the ACR EULA group, for example, trying to produce recommendations for the treatment of PMR, which is a good example where glucocorticoids are most important. Now, yesterday and the day before, I was asked, how can that be that a German hospital is having a French name? And to answer that question, I've just prepared 3 slides to explain that. So this is just to visualize where I'm working. It's very modern inside, but you see the outside is very historical. And that has to do with the fact that our hospital was founded more than 300 years ago, actually in 710. And it was actually founded as a humble plague hospital outside the Berlin city walls because the plague was just approaching towards Berlin. Finally, it stopped at Saxonia. In other words, it never reached Berlin, but we have had then this plague hospital, and that is why it was converted into a hospital for the local garrison and the civilian population a few years thereafter. And then, to give you the answer, 1 year thereafter, it was Frederick, oh sorry, I need to, it's, the other one is above. I'm sorry, I need the lace, oh no. Now you have seen almost all of my talk. Sorry for this. I will manage. So what I wanted to say was that it was Frederick William I, King of Prussia, who finally decreed this hospital should be called Charité. And charity, of course, means, as you can see here, benevolence, compassion, respect, dedication, in other words, Christian values. And to answer the question, why in French? Why? Well, at that time, German was considered to be the language for the poor people, whereas French was considered to be the language for the upper class. So if the king was saying something of importance, he was always using French, and that is why our hospital is having that name here. Now, just the last slide, in 1810, there was a foundation of our Berlin University and the establishment of a medical school at our university and at the Charité by outstanding physicians and great scientists. And I think most of you know these famous people. There are just 3 examples. On the left-hand side, you see Paul Ehrlich. He's very famous because he did he provided the basis for modern immunology. And then here you